Hi everyone, I'm Aniek and I'm a PhD at the Department of Medical Informatics at Erasmus Medical Center in Rotterdam. In the next 3 minutes, I show you why prediction models cannot be used to identify a complete and consistent set of risk factors by presenting our work assessing model stability across machine learning models developed in observational health databases. So it is known some commonly used algorithms to develop clinical prediction models, such as lasso logistic regression, are no consistent variable selectors. However, the practical impact of this lack of stability is often unclear. This is problematic because people often interpret clinical prediction models to detect risk factors, which we here define as variables associated to the outcome. In this work, we illustrate potential issues for risk factor discovery by investigating the stability of prediction models developed using lasso logistic regression. We performed a large-scale experiment developing over 450 different models with lasso. We developed models for 9 COVID-19 vaccine outcomes of interest identified by the US Food and Drug Administration. And for each of these prediction tasks, we then developed models using different definitions for the study population and outcome of interest. And we developed models in different databases mapped to the OMAP Common Data Model. This resulted in approximately 50 different models per task. For each of these 9 prediction tasks, we then investigated the model stability with the help of 3 questions. First, how many variables are selected across models? So in other words, is the size of the model similar across design settings? Second, are the same or different variables selected across models? And third, is the direction of effect of variables the same across models? So does a certain predictor always have a positive influence on an outcome, or can it also sometimes have a negative effect on a patient's risk? The results of our study showed substantial variation in the selected variables across models, as can be seen from the left figure showing low overlap in the top 10 most important variables across models. In particular, this also shows different databases lead to different identified risk factors. Moreover, we found that the full model was even less stable than the top predictors. Furthermore, we showed the sign of risk factors can differ across models, even for the most commonly selected variables. This graph visualizes the number of times each variable had a positive or a negative sign. So all vertical bars with 2 colors this indicate variables that do not always have the same sign. We found this is the case for approximately 46 to 73% of the variables across prediction tasks. So in conclusion, these and other results showed that overall model stability was quite poor in our experiments. So please remember, be careful not to overinterpret prediction models, as the identified risk factors appear to depend on the study design choices.